Hello and welcome back to CareTalk with CVT. My name is Ron Ballecer, and I am the Marketing Communications Manager for California's Value Trust. Today we're going to be talking about one of my favorite subjects, which is saving money. Let's face it, when we go out and shop for cars and shop for appliances, it's not uncommon for us to try and compare prices. A lot of us didn't realize that we can do the same thing with healthcare, which is why we're going to be talking with our friends at SmartShopper today to learn more about how you can do that with healthcare benefits. SmartShopper is part of CVT's Smart Care program, which is essentially a toolkit of programs that all do three things very well. They save CVT members money, they are very easy to use, and on top of that, they put money back in members' pockets through incentive programs. So today we're going to be talking about one of those programs called SmartShopper. And joining us today is Tom Mason from SmartShopper. One final note before I hand it off to Tom is that the SmartShopper program is specific to Anthem PPO and EPO members. Welcome to the pod, Tom.
Good morning, Ron. Thank you very much. I appreciate the opportunity to sit down with you today.
So taking it from the top, tell us about SmartShopper. What is it?
So we all know that healthcare costs have continued to rise, right? In most cases, those costs are passed on to us as the consumers. What most people don't realize, and you mentioned this, is that many of the procedures that we are getting every day can vary significantly in price just based on where we get those procedures done. So like an MRI or a colonoscopy, from one in-network facility to another, those costs can vary significantly. We also know that everyone today does some sort of comparison shopping, right? We either do it online, on the phone, or even in person. In fact, there's a poll out there that has said that 90% of U.S. citizens have said that they are looking for ways to shop or compare for their healthcare procedures as they would for any other everyday item, like automobiles or like housing or even shopping for groceries. And this is why the SmartShopper program was developed, right? It helps members to compare in-network care options, understand better their expected costs, and then choose high-quality, low-cost, effective providers, eventually to earn rewards in the way of a cash incentive for making better consumer decisions. And this program is brought to you by CVT as no cost to you, the member. It is available to all CVT members that are enrolled in the Anthem Blue Cross health plans.
What types of procedures are eligible?
So SmartShopper is ideal and designed for certain healthcare services that are typically planned in advance, right? It's not intended for emergency care or complex treatment plans such as cancer care. Together with Anthem, we have identified more than 140 procedures that are considered shoppable. And these services were identified using two criteria factors. The first being that the members typically have many choices for where they can get these procedures done. And then the second is that there is a substantial difference in cost from the high cost facilities to the low cost facility options. So again, when you think about SmartShopper, you're going to want to think about those everyday routine procedures like MRIs, colonoscopies, mammograms, lab and blood work. Physical therapy is a great service for SmartShopper, and then even some minor outpatient procedures.
So, okay, now that we know what's included, Tom, tell us how it works.
Ron, listen, we've tried to make this as simple as possible. We know that healthcare is very confusing and not all that user friendly. So we've gotten together with Anthem to make this program as simple as possible, as simple and easy to understand and to use for the members. So as an example, let's say that last weekend I was playing basketball and I hurt my knee. When I go to the doctor will most likely recommend that I get an MRI so that he or she can better understand what is actually going on with my knee, to get a good full picture of what's going on with my knee. After that visit, what's the first question that is typically asked by any member? And if you don't know the answer, I'm going to say it's, where do I get that done? Where do I get my MRI done? At that point, the doctor will have a recommendation. There might even be a specific motivation for that recommendation, but at this point, this is when we want the CVT members to understand and to realize that they have SmartShopper as a benefit of their CVT Anthem plan. So before I schedule or receive that service, I'm going to log into my Sydney application from Anthem, or go to anthem.com and search for MRI care. In the results that are provided by Anthem, there will be a direct link to the SmartShopper experience. Once the member clicks on that link and gets into the SmartShopper experience, SmartShopper will show them a list of in-network options of where I can actually have that MRI performed. That same list will display a reward amount available for each of the locations. All right. So after reviewing all of the possibilities that are presented, I'm free to choose the location that works best for me or my family. And the key is to check SmartShopper before receiving care so that you can confirm whether the service and the location are qualified for a reward. But once I actually choose that location, I will schedule the appointment, get the service completed. The claim is then processed through Anthem, and I will then automatically receive the reward that corresponds to the location that I used. Rewards aren't immediate. Unfortunately, as you can imagine, that whole process takes some time, and the timing can vary. So members typically will see that reward in the mail about 6 weeks after the procedure date.
Is there a limit on the number of times that a member can shop?
Nope. A shop is good for one procedure. So, and a shop is good for 13 months. So let's think about an MRI. That MRI again, I have a hurt knee. I'm going to go in. I'm going to shop, check out the MRI. Well, now my knee starts to feel better, or life happens, and I can't schedule that procedure immediately. So I schedule it for 3 to 4 months out. The system is smart enough to understand and to recognize that I did shop for that procedure prior to having the procedure done, and it will identify that I received that procedure at a rewardable location, and it will automatically send the reward.
Pretty easy to use. You may have to wait just a little bit to get the incentive, though.
Exactly. I mean, 6 weeks, it does take time. We do not pay a reward unless it's a closed, approved claim from Anthem. But there is a way for you to check, for you as a member to check on the reward status. Within SmartShopper, you can ask a question of our team of where is my reward, and they will be able to tell you where in the process that reward may be.
So pretty easy to use. You get the incentive at the end of the day, and you have some control over your healthcare.
Exactly. And that's what we're trying to do. At the end of the day, we're all trying to create better consumers of healthcare, which is what we are all trying to do, right? We need to take better control to understand what the costs are and to get better outcomes and lower cost outcomes, both for me as a consumer as well as for CVT as a health plan provider.
SmartShopper's been around for a while. You guys have perfected the process, so to speak.
Yep.
Any misconceptions that consumers have when using or before using the service?
First is that this is not forced redirection. We are not mandating where CVT members can get their care. This is simply a vehicle to show you what your options are. If you make the decision to go to one of the lower cost locations, then we will share in that savings with you. So again, we're not minimizing the network that is being offered by the health plan. What we're just doing is giving you an easier way to make an informed decision, and if you do, we'll share in that with the way of a cash reward. Some people think that this is a replacement for a doctor. This is not a replacement for a doctor. Doctor remains the person who guides you through the medical care. It's simply a place to go that gathers information to allow you to make a better informed decision.
None of this is mandatory. You, as a CVT member, you could just carry on the way you've been receiving your health care. But by going through this process and doing a little bit of shopping, the opportunity to get an incentive is there at the end of the process. So Tom, tell us about why CVT members should be using the SmartShopper program.
Well, the easiest answer to that, Ron, is just for cost savings, putting money back into their pockets, right? Because healthcare is on the rise, this is an easy way to put some of those costs to rest and to put money back in your pocket. We're not talking about $5 to $10 rewards here. By using the SmartShopper solution, CVT members have the ability to earn up to $1,000 per procedure. Now, each procedure does have a maximum. For instance, colonoscopy maximum could be $300 for a reward, as well as lab and blood work could be $25. But we're talking about real money that can help go back into the CVT members' pockets.
So, Tom, I've been on the website. I think it's pretty easy to use and very intuitive. But if people have questions, who should they reach out to?
Well, as we mentioned, we tried to make this as easy as possible. We tried to develop a solution that was simple to use, but we know that it's tough, and we know that people sometimes like to talk to real people. They like to get assistance. So we do have a team called the Care Concierge team that is here to make the shopping experience easier. Make it more personal, less overwhelming for members. They are real people. This is not artificial intelligence, and they're here to help. When a member needs a routine or scheduled healthcare service, the Care Concierge team can help them understand what service is eligible for SmartShopper, compare in-network care options, identify which facilities they can go to, which facilities are closer. They also have the ability to help with that everyday busy work, meaning they can help schedule appointments. They can assist with working through the Anthem health plan for prior authorizations to make sure that they have the ability to get the procedure done at the rewardable facility. So we have a team that's there to help. Again, they're not there to replace your doctor. They are just there to help you identify locations that could be lower cost and at the same time earn you a reward.
And on top of that, your team is willing to help schedule those appointments as well.
Exactly. We will work directly with the member, either when they're on the phone or in a chat with the member, or the member can leave a message for our team and they will work to schedule the appointment and then get back to the member. The SmartShopper Care Concierge team is really just there to add that personal human touch to this shopping experience.
So really the big question here is, why wouldn't somebody utilize the program?
I like the way you think, Ron.
Anything else, Tom? I think we've covered a lot today.
No, I hope that that all the CVT Anthem members go out and give it a try, take a look, shop for a couple of different procedures, see what's out there, and then give us a call if you have any questions. The contact number will be right there on the website and should be on any or all of the marketing materials that are available.
So for our viewers, if you have questions about SmartShopper, they can visit anthem.smartshopper.com. And if you have more questions about the Smart Care program through CVT, visit cvtrust.org/smartcare. To our viewers, thank you for joining us today. Tom, thanks for your time. It's been very informative. I hope everyone goes out and shops as soon as they see this. And to our viewers again, thanks for joining us. We will see you next time when we talk a bit more about the Smart Care program.